Hey guys, I'm a kidney doctor, but I realize I do not operate in some sort of healthcare bubble. COVID-19 has ravaged the world and the United States from a medical perspective, but also from a financial and economic one. As we continue to shelter in place, we need to contemplate what lessons do we learn, how life will change, and where does America go from here? What's up, San Antonio and world? I'm Dr. Qasim Butt, and I'm a kidney doctor. And I'm here to break down health in a simple way. Now do me a favor, hit up that like and share button. It'll really help me out. Now, the coronavirus pandemic has affected all of us more dramatically than any one event in our lifetimes. As we continue to shelter in place, after this is over, where does America go from here? So today's video are my thoughts, but it's really meant as a discussion where your comments are vital, and I really need your feedback. So here we go. As we shelter in place for several weeks now and not go anywhere, I begin to realize I actually really like my family. I like spending more time with them, even if it's the most mundane moments sitting around on the couch. For a lot of us, this is time to reflect and reprioritize what is important to us. This makes you realize that your time you have is limited, and you should do things that are actually more fulfilling. Perhaps we'll see a lot of people make a lot of personal changes in their careers, personal lives, and honestly, their spending habits. Now, economically, coronavirus is devastating. 17 million Americans have applied for unemployment benefits. The stock market has tumbled, wiping out some people's retirement. And last week in San Antonio, 10,000 families lined up outside the food bank. So I'm in the camp of a possible prolonged recession. But I'm really curious to know what you in the business community think as far as what you think the recovery will be like. So please give me some comments below. As far as innovations in the economy, I believe we just realized that a lot of us can work efficiently from a remote location at home. We also realized that we can have discussions and productive meetings via apps like Zoom. What implications does this have for the retail office space, large professional and business conferences that we fly to? Commutes to work, and basic time management. Now, we have all heard the medical horror stories in the media, but the one highlight I definitely see is the new utilization of telemedicine. When the coronavirus pandemic reached the United States, we had to prioritize which patients we needed to see in person and which we thought could stay at home. Turns out, a lot of them could stay at home, and we could do a televisit via apps like FaceTime, Google Duo, and Skype. Now that I'm doing them in my clinic, I actually really like them, and the patients are really appreciative of the whole experience. Although the older patients really do take a while to understand how to use their smartphone. Now, one of the main problems we encountered was lack of personal protective equipment. The most mighty economic, financial, and military force on earth was struggling because it couldn't produce this. Well, it's not only personal protective equipment and ventilators. 90% of antibiotics and a large percentage of other drugs are produced in China. Is it to America's advantage to have one nation, one that is not our strategic ally, produce so much of the medications our patients rely on, not to mention the other goods that are essential to the economy? In fact, I think that there's going to be a push for manufacturing to be brought back to the United States, or at least that we diversify our supply chains to different parts of the world. Well, those are just my thoughts on where we go from here due to the coronavirus pandemic, but I'm really interested to know what you have to say. So please leave comments below about what you think, what trends or innovations will result from this. And if you find this video helpful, please like and share it. And remember, it's your kidneys, your health.